Americans suffer from headaches. Chances are, that's you. Now, they can either be a small annoyance or something much more serious.
It gets to a point where the only thing I can do sometimes is be in a dark room with no stimulation at all, no light, no sound. And sometimes they can reoccur over days and days.
Open your mouth wide for me.
Monica Rodriguez gets migraines and has for almost 12 years. She tried treatment years ago but found no relief. She thought she'd have to live with the pain. Almost half of every month she spent with a migraine, and she spent the other half dreading them. But recently she found Dr. Hubert Leonard, a neurologist specializing in headaches at Providence St. Vincent in Portland.
Migraine accounts for about 12% of the U.S. population, so it's a big-time, frequent disorder.
Migraines are different from headaches. Most of them start with something called an aura. An aura can impair vision, it could be a tingling sensation, or it could even disrupt speaking or motor skills. This can be followed by nausea, dizziness, extreme sensitivity to sound and light, and in many cases, severe debilitating pain. There's one other big difference between a migraine and a headache. Migraines almost always run in the family.
It's related to the brain simply being different. It's more hyperexcitable. It responds more to external stimuli as well as internal stimuli.
Those stimuli can be almost anything. Monthly hormonal changes in women, weather changes, drinking too much alcohol, diet, and even stress. With so many potential triggers and so many different symptoms, how do you know if you have a headache or a migraine?
Follow my finger up.
Often you can't without seeing a doctor.
So the whole idea of seeing a physician is to try to sort out the reason for the headaches, and the key there is the history.
Your own health history and your family health history can help a doctor diagnose you. Thankfully, whether you suffer from headaches or migraines, there have been many advances to help you manage pain. Over-the-counter pain medicine might help, but be careful of trying to manage the pain yourself. If you take pain medication more than 10 days a month, you run the risk of creating rebound headaches.
When they take the medication, the headache goes away. But during the night or the next morning, the headache comes back, they have to treat again, and they're in this up and down cycle repeatedly, and that's what we think of as rebound.
Often, if you can stop this cycle, you can ease the occurrence of migraines. In addition to being aware of the rebound effect, there are also some things you can do at home to reduce your risk of migraines and headaches.
The general rule is live a clean life. Don't you love that?
Go to bed at the same time, eat on a regular basis, manage your stress, and avoid triggers that you know might cause your headaches.
So if you would look straight ahead.
As for Monica, her migraines haven't stopped, but they are getting better.
I sort of had this little glimmer of hope, but I didn't want to get too excited because I just kind of accepted that was how it would be. So but we're making some strides for sure.
If you want to learn more, Providence invites you to a free talk on women and headaches in November. Learn more by going to the Providence Health page on kbtv.com.